Hey everyone, today we are going to discuss about Alzheimer's disease. As we all know, it is an irreversible condition, but the prognosis varies with the staging. So, better to diagnose at an early stage for a better prognosis. If not reversible, at least we can stop it at the point it is diagnosed. The further risk that it carries, the further stages that it carries, we can prevent those stages if we diagnose it like early. So if we come to stages first, so stages, there are like three stages we can categorize them, that is mild, moderate and severe, or we can say that late, is early, mid and late onset. So in the early staging, we, as we know, this Alzheimer, the lobes that is affected are parietal lobe, temporal lobe and the hippocampus. These are generally involved. So the features also follows with that, what are the means in the parietal lobe, what are the activities that were regulated by parietal lobe, and the frontal, temporal, parietal, as you know, no? As we understand the brain neuroanatomy, we'll get to know that. So here we are going to discuss and cut it short. So let's discuss the features or the stages. So the features that is present in the early stages, that is forgetfulness, that is the first differentiating criteria, and there is a difficulty, that is short-term memory loss, difficulty in recognition. So forgetfulness, it includes everything. So this is like typically the early staging, and the late means the mid onset, there is a disorientation, there is a language problem, there is mood changes, and there is a difficulty with comprehension and other many complications. And with the late stages, as we know, that late stages further prognosis, further worsening of the prognosis, further memory loss. So there is like totally memory loss, they are just dependent and they have inability to communicate and totally dependent. So yeah, that's why the prognosis varies with the stage now, so this is a reversible injury, as we have discussed, and it is a, first of all, it is a neurodegenerative illness. We don't have to utter this because we know this, right? And we are cutting all the histories of the Alzheimer. Just we are coming about, we here are discussing about the crisps, like the top top picks of the Alzheimer's. I have like picked up things which are mainly exam focused, knowledge focused, and mainly first though we should firstly we should focus on our knowledge, then comes the exam, either paid NEET, PG, SS, or anything sort of medicine, in MRCP or any exams. Even if you are an MBBS student, that will be helpful for your knowledge. So because this video is only for knowledge purposes only, I am a licensed practitioner, myself Dr. Vijay Kumar, and today we are going to discuss Alzheimer's disease. So let's dwell into this. So first of all, this Alzheimer, the features. So there are 4 or 5 A's we can remember through that. That is first is amnesia. Then there is what do you mean by amnesia? There is partial or total loss of memory, as we have discussed. Alzheimer's is like memory loss. Then there is aphasia, that is language problem, problem to speak, communicate, like we used to. And that is apraxia, that is loss of execution of the motor or the movements, whatever we know, they still know, but they are not having the proper way to execute it, that is apraxia. And then there is agnosia, there is loss of recognition of sort of that. And there is anosognosia, that is unaware of their own illnesses. They don't deny it, they have some problem, they don't really consider it a problem because they don't know they are facing this problem. So yeah, and overall this 5 things doesn't come one after another, it doesn't follow a chronology, it just depends on the case to case scenario. So yeah, let's dwell into this. One sec. Sorry. So yeah, so overall we have discussed like the basics of Alzheimer's. So now let's see how to diagnose this, like how to diagnose Alzheimer's. So first of all, first and foremost is history. history taking is very important. And if we see through mini mental state examination, that is MMSC, we score out of 30, and if the score is like 23 or less than that, we consider it as a typical case of Alzheimer's. And then we can go ahead and access, that is physical evaluation and a neurophysical evaluation examination. Then we can go for a brain MRI, that is to just it will show some atrophy, and it confirms that there is some shrinkage going on. So there is the, you know, about the features what we discussed, so we are experiencing these features. And then we can go for biomarkers, as we know that is there is beta amyloid deposition, tau proteins accumulation. So through CSF analysis we can find that. Then we can go for FDG PET, you know, where we can see there is a tracer, so less uptake or hypometabolism in those temporal and parietal areas where we have discussed. These are the areas which are affected, mainly the temporal, parietal and hippocampal area, you know. And if the what we say it, if the unit, the tertiary care unit is like fully equipped, then there can be also markers like A beta 42, A beta 40, and this will show low uptake. So yeah, so there is something called ApoE. The full form is apolipoprotein. So these are of three variants, that is ApoE2, E3 and E4. Now E2 is a protective variant for Alzheimer's. E3 is no risk, or we can say is neither protective nor non-protective. So it is like no risk for Alzheimer's. And E4 carries the highest risk because it is non-protective. It is just opposite to that. You know, so we'll discuss how this ApoE protein plays a very crucial role. According to NCI, NSH, you know, NIH, yeah, National Institute of Health, and that Stanford Medicine, they have just published an article about this, about apolipoprotein E1, E2, E3, E4. In Alzheimer, only these three plays their role. So E2 is protective because it clear plague, you know. It supports that what we call it, as it clears plague, you know, and so it really has that protective role. So that beta amyloid and all deposition, it clears that. Now, as we discussed, that is E3 is a baseline, there is a no risk, and what we say that E4, it is non-protective as it accumulates the amyloid beta deposition. There is a amyloid beta accumulation, and that is harmful as the microglial activation in the brain. So it further progresses the disease. It causes disease progression. So we have discussed about the apolipoprotein E2, E3 and E4. Yeah. E2 is protective, E3 carries no risk, and E4 is non-protective or will cause disease progression. How? We have just discussed this. I am not very well furnished now, like, you know, but I'll try my best to make you explain it. So there is a amyloid plagues. There is a beta amyloid protein accumulation in this, which causes decrease in ACH, decrease in non-adrenaline, decrease in serotonin uptake. So there is a drop of almost all this. There's a decrease in ACH in the nucleus of bacillus minor, decrease in non-adrenaline in the locus coeruleus, and serotonin decrease or depletion. You know, that is in the, what was it, like dorsal yeah, dorsal okay, let's carry forward. So yeah, so the lobes that we have discussed, that is temporal, hippocampal and parietal lobe. Yeah, and as you have seen about the how we'll diagnose it, you know, how let's see how we can treat it. So the treatment is based on the features and also the outcomes. So we use mainly we use that donepezil, rivastigmine, GABA, galantamine, you know, to improve cognitive function. That is, these are all the cholinesterase inhibitors. We can use memantine, that is a NMDA receptor antagonist, and which is used in moderate to severe cases. And there is a great drug called aducanumab, which is targets amyloid beta, and it just clears the plaque. So yeah, and just we can also go for behavioral and supportive therapy, that is cognitive therapy, and the symptomatic treatment is we can go for SSRI, and antipsychotics, because the patient develops this, with time, with prognosis, with progression, and with a bad prognosis. If it comes in the later stage, we can't have so much option left, so we'll go for the symptomatic, behavioral management and everything. And there's very crucial role of caregiver support. The family matters the most for these patients, this type of patients, as these type of patients are really they are all forgetful, they don't know what they are facing, and yeah, they have inability to communicate, inability to apprehend, can you feel about that? Yeah, so the family, they should be the backbone of such patients, so so that they can lead a great life. Whatever they have, they should be the best hour, do the best of it. So thank you, hope you enjoyed this video. I'm not that great till date, because this is my first video about this, and I'll come up with more videos just for the knowledge purposes only, and solely. And I'm also preparing for my NEET SSDM, so I guess that will be a wise idea just to share